Today we're here at the Union to figure out people's opinions on drug resistance and bacteriophage therapy, and if they know what it is or not.
My name is Ruben.
Hello, Ruben. What do you think about the current antimicrobial drug resistance problem? AKA, we try to kill bacteria, but they're resistant to the drugs.
I think it makes a lot of sense. It's just basic biology in my understanding. And it's not surprising it's an issue, but a little bit of foresight maybe could have prevented it. And it's kind of the kind of thing that's hard to stop once you start it. So I don't know that much about it, but
yeah. What do you think could be a possible solution?
I can't think of any good solutions, being a not very well versed on the topic. I think just stopping it cold turkey, stopping all kinds of prescriptions and medication and all of that would probably have some pretty terrible ramifications and would fix the problem in the long run, but yeah, it would probably come with a lot of suffering.
Yeah, for sure. Because you can't just stop.
Not a good short-term solution.
Have you ever heard of a bacteriophage?
Nope.
So basically what it is we basically just give you a virus, and the virus only attacks what we want it to attack. It will just kill the bad bacteria. So if you have like an infection, we can just give you bacteriophage therapy and it'll just kill it.
It sounds like a little bit over-reliance on technology. A little technocratic. I don't trust it.
You don't trust it?
Yeah, we're in a lot of the positions we're in right now because of using technology we didn't understand fully, and there's nothing to say that any new technology won't have equally terrible repercussions in the future.
Would you agree that the benefits would offset the negatives though?
I couldn't make a statement on that until I spent a lot of time looking at the benefits and the repercussions, the negatives. But I think with something like that, it's much more wise to make a decision after you've thought about everything and compared everything very thoroughly, rather than trying it and seeing what happens afterwards.
Okay, thank you. Bacteriophage therapy is the use of bacteriophages to kill bacteria that have developed antibiotic resistance. It has shown success in treating various infections like endocarditis, dysentery, and some others. It has recently gained traction due to a rise in antibiotic resistance among many bacteria that we try to eliminate, but we can't. Especially the common ones that you may have heard of, like penicillin, amoxicillin, macrolides, cephalosporins. Anything that has a beta-lactam ring is just gonna develop resistance through their enzymes. But you may be surprised to know that bacteriophage therapy has been in existence before even common antibiotics were distributed among the public. For context, widespread use and administration of antibiotics started around the 1940s. According to Derek M. Lin et al., bacteriophage therapy was first used in 1919 to treat 4 pediatric cases of bacterial dysentery. 4 years prior, bacteriophages were discovered due to an observed phenomenon of bacterial lysing, aka bursting. A famous experiment in 1931 showed a 90% decrease in mortality in patients in Punjab, India, when the subjects were given the phage therapy. This was used to target cholera. Another clinical trial in 1938 showed a case of 74% of patients with bacteria dysentery either showing improvements in symptoms or completely alleviating those symptoms. Despite some examples of phage therapy proving useful, it was kind of shoved to the back burner when antibiotics became widely used, as previously mentioned, around the 1940s. However, circulation of discussion around bacteriophage therapy is becoming louder, and we're in a period of rapid advancement.
You may be wondering how bacteriophage therapy works. Now, the therapy is administered to humans by applying the phages through topical cream on your skin or injecting them / orally consuming them into our body. Now, those phages are going to fight bacterial infection that are resistant to antibiotics. To understand how the phages kill the bacteria, we need to understand that phages are viruses, which means they are incapable of reproducing independently, and that they need a host to survive. The bacteria act as the phage's host in this case. Now, the process of how the bacteria are killed is simple. According to Derek Lin in Phage Therapy, an alternative to antibiotics in the age of multi-drug resistance, the phages bind to specific receptors on the bacteria cell surface using their tail fibers. Once binded, they inject their genetic information into the bacterial genome. This allows them to reproduce within the bacterial cell. Upon reaching a critical amount of phages within the cell, the phages kill the cell by causing it to burst. This releases all the phages within the cell, starting the cycle all over again. Now, most phages are only infectious to the certain bacterium that carries their complementary receptor. Because of this, you don't have to worry about phages reproducing within you and causing your human cells to burst. With more phages on the earth than there are a number of organisms combined, this makes finding the specific phage needed for treatment a little difficult. With more research, we may be able to find higher uses for the phages on top of how they are used today.
How are they used today, you may ask? The most common use for phages is to treat bacterial infections as antibiotics resistance continues to become a problem. According to MDPI, they have many applications, including as potential alternatives to antibiotics against multi-resistant bacterial pathogens and as control agents in bacteria-contaminated environments. Antibiotic resistance is continuously a problem in our world today. World Journal of Gastrointestinal Pharmacology and Therapeutics explains, the CDC estimates antibiotic-resistant infections result in 2 million illnesses and at least 23,000 deaths a year, with many more dying from conditions complicated by antibiotic-resistant infections, costing the United States $55 billion annually. It is important for us to realize how serious of an issue antibiotic resistance is in order to progress further in science and medicine. Although phages have not yet been approved by the FDA for any human uses yet, there are many ideas bouncing around the science community about how to increase the effectiveness of antibiotics or act in the place of an antibiotic. One example is against an infection called Acinetobacter baumannii. Healthline explains there have been many successful cases of phage therapy use. One such success story involved a 68-year-old man in San Diego, California, who was treated for a resistant kind of bacteria called Acinetobacter baumannii. After more than 3 months of trying antibiotics, his doctors were able to stop the infection with bacteriophages. Another potential use is against the very powerful Staphylococcus species known as MRSA. MRSA would be a good contender for phages because it is highly antibiotic resistant. Now that you know what a bacteriophage is, how they work, and how they are used today, you may be wondering what some benefits and consequences are. One of the benefits is treating an infection that has a biofilm. According to the Journal of Pathology, Microbiology, and Immunology, bacteriophage therapy is a re-emerging antibacterial treatment strategy for difficult to treat infections, mainly biofilm associated and caused by multi-drug resistant bacteria. Knowing this, scientists and doctors can work together to fight these hard-to-beat infections and diseases.
A consequence of the therapy is that there is a possibility that the phages cause intestinal barrier dysfunction within humans. According to Derek Lin, this dysfunction, also known as leaky gut, is due to the phages being capable of increasing intestinal permeability and elevating serum levels of inflammatory circulating immune complexes in the blood. This can have serious implications for the cause of several intestinal disorders like Crohn's disease, inflammatory bowel disease, and type 1 diabetes. Phages can also release harmful endotoxins. According to Bill Hayata, in the removal of endo and enterotoxins from bacteriophage phenomenon, phages release the toxins when they lyse pathogenic gram-negative bacteria. High concentrations of these endotoxins can be harmful to the human body. Going off of this, with it being a relatively new treatment for bacterial infections, there obviously isn't enough research on the negative effects of the phages on the human body. there's just a lack of pharmacokinetic data on phages, making possible negative human effects unknown. Also, with there being more types of phages than there are organisms on the planet, finding the right phage necessary for treatment is a difficult process. According to Jiaxi Lin in Limitations of Bacteriophage Therapy, bacteriophages are useful in managing diseases caused by a single bacterium, but most clinical infections are often caused by a variety of pathogens. This makes a single phage very difficult to have a therapeutic effect.
Overall, bacteriophage is a fascinating advancement in medicine, capable of solving a worldwide problem that is antibiotic resistance within bacteria. Its ability to combat the formation of biofilms is also another major benefit of the therapy. Despite these benefits, there are some setbacks to the therapy, with it being difficult to find the specific phage needed to combat a specific infection, its effects on the human, and there just not being enough research on phages and the therapy itself.
In conclusion, bacteriophages are a good alternative to treating antimicrobial resistance to the drugs that we are currently using. Along with this, more research needs to be done to find the correct phages to treat more bacterial infections, and more money and funding needs to be put behind it, as well as more manpower, so that we can find more phages and isolate them so that we can make them useful.